Hi, welcome back to your healing channel. This is Dr. Stephanie Reed, and once again I'm here to shed light on the information that can be found in a hair tissue analysis. One specific point of information to consider is our energy level and our immune function. So the hair tissue analysis will tell me exactly what your thyroid gland is doing. Your thyroid gland is located here at the base of your throat, and most of us are familiar with the terms hyperthyroidism, means speeding up too fast, and hypothyroidism, which means our thyroid gland is slow. Some of the misconception about what the thyroid gland means needs to be fixed. So when you get a hair analysis, your thyroid function is determined to be fast or slow. Normally we think that a person with a fast metabolism or a fast thyroid function would be, pretty thin. That's not always the case. So we can sort of determine weight loss and weight loss strategies based on the thyroid function and how to address those issues for the best way. Another point of information on your hair tissue analysis is your adrenal gland function. Your adrenal gland sits on top of the kidneys, and they regulate the salt and the water balance. The interesting thing about the adrenal gland is if your adrenal gland is responding to stress, it's going to work overtime. It's going to pump out salt, and it's going to pump out water to dilute the salt. That in turn will add volume to the fluid already in the blood vessels, and that in turn will cause hypertension. A lot of people think that hypertension is really about the heart, but many times it's about your adrenal gland and its stress response. So what benefit that natural medicine has is we can determine your true cause of your hypertensive state and then sort of recommend avenues to treat those states. So for instance, if your hypertension is due to adrenal fatigue or some sort of adrenal deficiency, can't talk today, then we would address the adrenal gland, and guess what would happen? The hypertensive state will be reduced on its own. So we've seen that a lot of our patients have actually been given the green light to reduce by their primary care physician's consult, or even remove hypertensive medications from their daily regimen, which is what we basically want to do here. We want to fortify the body so more people can experience a better quality of life without the use of pharmaceuticals, because we all know that pharmaceuticals have a downside. So that's the benefit of natural medicine. So here's another hair tissue analysis, and I wanted to share with you some of the things that came up with this report. This particular person, here's all the tendencies that's going on in this person's body. So normally when a patient comes in, they express some concerns or conditions that they've been experiencing, and they want to understand why they feel that way and how we can fix it. So the hair analysis really gets to the bottom line of what's really going on with the system. So this box here represents what the lab has found to be going on in this person's system just by imbalances through their minerals. So I'm going to put the paper down so I can sort of go through it and show you what we can find. The first tendency that this patient has is arteriosclerosis. And arteriosclerosis is related to a magnesium deficiency. Go figure. It says studies have found that dietary magnesium intake is frequently found to be low in individuals with low blood sugar disturbances, and arteriosclerosis compared to control groups not having these conditions. Magnesium deficiency relative to calcium indicates poor calcium metabolism, and this patient's pattern indicates a tendency exists for calcium deposition into the soft tissues, including the arteries. So let's sort of break that down and understand what that means. When calcium and magnesium are working in the body, they're supposed to work together, not one above and not below. These imbalances is what causes that disease state. In this particular case, a magnesium deficiency is allowing calcium to rise up very high, and if the body's not utilizing the calcium goes wherever it wants to, normally into the tissues. This would also cause dry skin, dry hair, and sometimes even hair loss in the hair follicle. So when a patient comes to me regarding their skin problems or maybe their hair problems, getting to the root cause of a hair tissue analysis will tell us exactly the why of their symptoms. So this calcium seems to be depositing in the person's artery wall, which is causing the arterial sclerosis. Another thing that I wanted to point out was depression. Depression in this particular patient was very high, and the tendency of depression is because of their low thyroid function. It says depression and hypothyroidism. An elevation of calcium relative to potassium is associated with hypothyroidism. Depression is often seen when a concomitant hypothyroid condition exists. What that means is if there's an imbalance between calcium and potassium, you will experience depression. The interesting thing about the depressive state of a lot of us are depressed, and we can contribute that to economy, the high price of gas, social economic stratas of our community, and all the other things that might cause us to be down. But the reality is depression itself can be contributed by calcium and potassium ratios. So think about this, how natural medicine can work even for mental health. If you're depressed, you would probably go to a psychotherapist, which is a wonderful resource for mental health care. However, the downside may be that you would be required to take a psychotropic drug to get rid of the depressive state. Well, it may or may not work, and you'll try it for 3 or 4 weeks, and if that doesn't work, they'll try something else. But in the meantime, while you're trying those things, you're polluting the body, which is making your resolve even weaker, and your body's not going to really be too happy about you adding all those drugs in the system. So, coming to a naturopath, you'll get a better assessment of how to use alternative ways to deal with depression. Just by balancing your calcium-potassium ratios, guess what? The depression will go away. So that's a perfect example of how natural medicine can assist in mental health conditions. Again, we're going to talk about the dry skin and the calcium, but calcium also causes fatigue. Fatigue, high calcium to potassium, is associated again with the low thyroid function, and that's also will cause you to be tired. So let's think about the weight component again for the hypothyroid situation. Number 1, it's going to make you tired. Number 2, a hypothyroid means your metabolic rate has slowed down, so if you're eating more than your body can break down because your thyroid gland is slow, then you're going to have the tendency to gain weight. Here at Your Healing Place, we address actually weight issues by delving into the metabolic rate and then balancing that out. In addition, we also have specialized personal trainers that can help you actualize your weight loss goals. So natural medicine, again, is preventive medicine. Going down to one of my favorites is insomnia. We're taking a lot of Tylenol PMs these days because, let's face it, we're tired, we're fatigued, we're burning the candle at both ends because we have to get things done. The reality is we're tired, and that tiredness can also be a mineral imbalance. The mineral imbalance that causes insomnia is very interesting. It's magnesium. Magnesium is a sedative mineral as well as calcium. So there are 2 types of insomnia that we can determine. Insomnia is characterized by going to sleep but awakening frequently is associated with increased magnesium requirements. The person who tosses and turns at night, even though he may be unaware of it, could be suffering from increased need for magnesium, which means you don't have enough. So again, natural medicine is preventive medicine. So if you're having problems with insomnia, if your skin is dry, if your cardiologist has told you that you have atherosclerosis and they wanted to do a stent, maybe there are some alternative ways that you can consider to be healthy. Hopefully you will choose to investigate natural medicine, how we do it, at Your Healing Place. This is Dr. Stephanie Reed signing off, Your Healing Channel. Until next time.